In the next decade, you might be treated by a doctor you never meet in person. That's especially true if you live in a rural area.
At a symposium on telehealth Thursday at Lehigh University, local healthcare providers spoke of a growing reliance on technology to connect doctors and patients. Geisinger Health System, for example, may start looking for out-of-state doctors to provide mental health therapy for its rural patients.
The access issues are such a problem that we've gone out and started saying we want to hire doctors who may not want to relocate to rural central Pennsylvania and can practice from wherever they are, said Tejal Shura, manager of innovations and research at Geisinger Health System. But at least we're getting our patients seen. More and more Americans are living longer and they're increasingly online looking for cheaper and more convenient ways to get health care. Hospitals are betting on technology, such as video conferencing, to bridge the gap between the growing patient population and the limited number of doctors, nurses and healthcare workers, especially in rural areas. But insurers and government payers, such as Medicare and Medicaid, are slow to accept and pay for such services, hospital administrators and doctors say. Medicare, which insures senior citizens as well as younger disabled people, pays only for telehealth services in select rural areas, which doesn't include Monroe County and a number of other places, said Joe Tracy, Vice President for Connected Care and Innovation at Lehigh Valley Health Network, which has a hospital in Monroe County.
Dozens of states require healthcare payers to cover the costs of digital health services if they pay for those services in regular doctor's office visits. Pennsylvania legislators are considering such a law. Telehealth is an emerging industry that includes remote patient monitoring, video conferencing between doctors and patients, and remotely tracking the vital signs and medical images of patients. These practices can be convenient and cost-efficient, improve chronic disease management and expand access to rural areas. However, some patients may find the visits impersonal or experience glitches in sound and video.
Telehealth accounts for a small fraction of the care delivered at LVHN and St. Luke's University Health Network, but is expected to grow, hospital officials say. Both networks offer around-the-clock digital doctor consultations for mild health issues for $49.
And both have hospitals are apt to use telehealth in rural counties where there are fewer specialty services.
For example, patients at LVHN Hazleton may see an infectious disease doctor through telehealth technology, Tracy said.
The Symposium on Federal and State Policies on Telehealth was organized by the Lehigh Valley Business Coalition on Healthcare, which helps businesses find lower-cost healthcare options. Speakers included administrators and doctors from LVHN, St. Luke's, Geisinger, Capital Blue Cross and the University of Virginia Health System.
The keynote speaker, Dr. Karen Rubin, shared the successes of the telehealth program at the University of Virginia Health System, including a decrease in missed appointments and a travel savings of millions of miles. The program also brings important services such as mental health care to hard-to-reach places, such as prisons.
Rubin, the medical director for the Office of Telemedicine at the health system, said mental health care is the biggest telehealth demand.
Most of the technology that's needed to provide long-distance care has been around for decades, but health systems are hoping to make telehealth a part of most doctors' and patients' routines.
We're starting to see a spike as the early baby boomers are aging into Medicare, said Brooke Norty, an administrator at Capital Blue Cross. They're coming in and they're comfortable with Facebook. They're texting their grandkids, so they're not afraid of technology.